not least, and I hope you're all still awake, because I know you all had lunch, so hello, wake up. So I'm just going to tell you a little bit about the Cancer Support Network and the Hospital Patient Partnership, and also just touch on the Thames Valley Cancer Alliance. So I have lots to tell you, so hopefully it will be of interest. So basically, I run the Cancer Support Network for Involved Community Services. And so what is that? Well, it is basically a community resource for people affected by cancer, and that's any type of cancer. And the area we cover is Woking and Bracknell boroughs. And why is it needed? Well, I think we all know why it's needed, but it's all about people feeling well supported whilst going through their journey, as we don't want to call it. And we did find that the sort of pinch points were upon diagnosis and then following intensive treatment. And that research was done some time ago, because the Cancer Support Network has been around about 5 years now. And as you're all aware, the prevalence of cancer is going up. And I got this from the Macmillan website. So I sort of saw this and I thought, oh, it's a bit of a worry. So this means that all of the services that we deliver are going to be under more strain as we go forward. So it's something to think about as we develop these services and look at those as we go forward. And interestingly, the news article that was in the news this week was about younger people being diagnosed with cancer. I don't know if any of you caught that this week, but I thought that was quite an interesting piece of news, really, because we think about older people having cancer, but actually there's a lot of younger ones that are being diagnosed as well now. So what do we do? How does it work? Well, we have a range of services. We have meetups, which are very popular. We have coffee and chats every month. We have expert speakers, so we have different topics, a bit like the Cancer Rehab team. We have different topics that we talk about, and we kind of go out to our network and say, what do you want to know about? And they'll go and find somebody that can tell more about it. So the next one, for instance, is about hair. So if you wanted to know about hair health, then do sign up for our next talk. And we have health and wellbeing events. These came out of COVID actually, because we wanted to keep everybody connected, and this was a good way to do it. So one of the first things we could do was go outside. I know how exciting that was at the time. And we started the Nordic Walking Group, which has become phenomenally successful, and everybody loves that. So that works really well. We do that in 6-week chunks, and it means that people are active, they're outside, they're getting to know other people, they get to make friends. I mean, it's very valuable indeed. We have our peer-to-peer support, which we also call Cancer Champions, which I'll tell you a little bit about in a minute. And we also have our online support. So we have a WhatsApp group for our cancer network, which is really very useful actually. And people will put things on there like, I had radiotherapy the other day, I've got a really sore spot, what cream did you use? And then they can ask a range of people what they used. You can't really do that anywhere else. It's quite unique in that sense. Equally, someone might reach out and say, do you know what, I'm having a really bad day, I've got scan results coming up in a couple of days, I don't really know how to feel about it. Can somebody just give me a bit of advice? And then somebody will come on and say, I know how you feel, and I think just knowing how they feel helps them. Just knowing somebody else is out there that's been through this experience. We've also just set up a similar situation for partners, family members and carers in terms of a WhatsApp group, and that is growing and developing, and actually there is very little out there for the other halves. So this is quite interesting to watch and see how that develops, because they have a different conversation to the people with cancer. And the people with cancer don't want to have the conversation they might have with people with cancer with the other half. So it's quite an interesting area for them to get support from when they can talk to people that have the same experiences. We also have signposting and information, so that's me telling them all about all the brilliant things that everybody and all the other things that are out there, and all those tables out there. So I tell everybody about everything, hopefully, so that we are just communicating, really. That's half the battle, I think, half the time. So, in terms of our cancer champions, they are volunteers who have had their own lived experience of cancer. And they are professionally trained. We use the involved training programs, and they are DBS checked. So it's a full program of training and checking and safeguarding and confidentiality, and it covers everything that needs to be covered. They offer support to someone who is matched to them. We do that on an initial 12-week period, and then we review. If that person needs further support, we continue with that support. So it is about lending the listening ear. And the beauty of this is because it's local, they can also meet up for a coffee if they want to. They know the area. They can talk about, the garden centre because they'll know where it is, things like that. So because it's local, it has that sort of aspect as well, which is really nice. And quite often it's telephone support, but as I said, they can meet up for a coffee. And this is important, and we've seen it actually. It just gets people over a hump quite often. And quite often it can be sort of just after diagnosis, or it can be when they're really struggling with some treatment. And they just need someone to talk to. Outside of their friends, outside of their family, just someone that they can talk to and just really just say how they feel. It was interesting actually, at the weekend we had one of our cancer champions met up with one of our breast ladies for coffee on Saturday morning, and they had a really good chat and everything else, and they went home, did their thing, and interestingly we met up with them on Monday about our coffee and chat, and our breast lady said, I went home and just cried buckets. I just cried buckets. She said, I don't know what came over me and I don't know why I did it, but I felt better afterwards. And it was like, she didn't expect that reaction either, but it worked for her, and that's what happened. I suppose it got it out, if you know what I mean. So it's amazing, it's amazingly valuable. In terms of accessing the support network, it's really easy. Anyone can access it with any type of cancer. We don't support children, we signpost children, but anybody else, anybody over 18, we support. So basically we take referrals from GPs, health professionals, the Joy Social Prescribing app. If anyone has the joy of the Joy Social Prescribing app, we are on there. Family members can also come to us, you can make a self-referral. We've actually got quite a lot of self-referrals. We do seem to get quite a lot of those. But feel free to refer them to us if we can help you. You can do that by telephone, email, millions of different ways. We're on social media as well, so Facebook, if you're on Facebook, if anyone's still on Facebook, we're on Facebook. And Instagram, we're down with kids. So the network is important because, for obvious reasons, we're helping the health and well-being of individuals affected by cancer. It goes without saying, really. We offer bespoke support. We have a wider volunteer network, and we're there to educate and inspire cancer patients as well as everything else. We give them information about their treatment, so we talk about things like nutrition, care, sleep, all sorts of different things that we talk about and try and educate them about. We also obviously raise the profile of cancer support locally. We promote actual campaigns such as cervical screening, that sort of thing. And we sort of try and work alongside the NHS long-term plan, along with all the health professionals in the room today. So in terms of what we've been up to, these don't look massive figures, but actually each person is a person, and they actually access this service multiple times. They don't just come to one thing, they are part of the family, if you like. And so far this year we're up to 30 referrals, which March was quite busy, April was quite slow, May was reasonable, and I don't know what June's going to do, so we'll see see what happens there. But bearing in mind that cancer prevalence, I'm assuming it's going to go up. We've had various sessions, we've had various coffee and chats, we've done seasonal walks, and Nordic walking is very successful. And Qigong sessions, everybody loves those. They're done online, so you don't need to go anywhere, you don't need to panic about parking, you don't need to worry about not feeling too great. You can do that at home in the morning, have a nice session, feel better, sort yourself out for the day. And we work with health professionals who contribute to patient partnerships and support group networks. So we do what we can where we can, really. I don't know if you've got any questions around that particular bit at this stage.
What is this Qigong?
Qigong, yeah, it's a bit like Tai Chi but gentler. It's quite nice actually. It's a bit like active mindfulness, they call it. And the people that do it love it. Yeah, it's really nice. I tried to do it, but it hasn't worked. So now I will move swiftly on to the Cancer Patient Partnership at the Royal Berkshire Hospital. So I am now the patient representative chair for this group. I'm fairly new in post. Really just kind of came into this in January, having been in the group anyway, but having this position is new for me. So just really finding my feet. So what is it? Well, this particular one was established in 2019 to enable the patient voice to be heard by health professionals within the hospital trust. And it gives opportunities to patients to engage with health professionals and highlight issues and work, obviously, together to resolve them. So the patient voice is very powerful in that respect. The group is made up of volunteers, and they have been patients within the hospital. And Martin, who you saw earlier, is in this network as well. In terms of our objectives this year, it's very much about consolidation of the current projects, looking at where we are with everything, and identifying further issues that we need to address. And so obviously we want to highlight successes and challenges as well as engage patients. And we're looking for opinions, ideas, positive engagement. And we want to have a fairly strategic approach around how we do this in terms of aligning with other organisations such as the Thames Valley Cancer Alliance and obviously the Royal Berkshire Hospital strategies. So we want to be joining up dots. We want to be looking at making sure that we are covering all of the issues that need to be looked at, really. In terms of the way in which it works, we have meetings throughout the year, and we identify project areas that need to be looked at. We currently have 6 of those. Volunteers attend 4 central meetings, and then they can engage in a particular project area. And then they will be allocated that project. And then they work as a small team to make that happen. And then they report back to the central group with activity and outcomes that they are achieving. And we're working with the health professionals in the hospital to do that, as well as the community. So it brings everybody together, essentially. Recruitment. So we're looking for more people. So if you know of any patients that will be interested in this opportunity and taking part in this, please do point them our way. We do have a leaflet, which is there, which I think Chris has sent out as well recently, haven't you, Chris?
I sent it out to support group.
Yeah, to support group. So if anybody wants any of these, please do say. And Shirley's going to have some in the Macmillan Information Centre as well, when we work out how to get them printed. So we're looking for more participation, really, from patients that want to have a voice, essentially, want to make a difference, have gone through treatment, may have something that they've identified as something that they think needs improvement, or that have some brilliant ideas, anything really. So we're looking for more people. And as I said, we're just really looking at a fairly strategic approach around including all of the sort of different networks, different people involved in the cancer centre, to make sure that we're all talking from the same place really, and all talking the same language, and sharing ideas, best practice, all those sorts of things, so that we're not all sort of working in our silos. We want to work together, and I think that's really important. So I don't know if anybody's got any questions around the patient partnership within the ARRS. Must have explained it perfectly. Right, so I'm just going to touch on the Thames Valley Cancer Alliance. Lisa, who I'm sure some of you will know, is my contact there, and she has just asked me to touch on this, because obviously this is also part of what happens in the cancer space. So obviously the Alliance was set up in 2016, as she said here, and they're fairly central in bringing together services and looking at different things that are going on across the BOB footprint in particular, and talking to commissioners and people affected by cancers, and all sorts of different people, health professionals, and they enable local partnerships to plan, transform and deliver cancer care more effectively with joint decision making. So what they actually do is they work with cancer prevention and early diagnosis, faster diagnosis, treatment and care, personalised care, patient engagement and patient experience. So they have a fairly sort of broad view really. And that's their strategy for this year so far, which is huge, and I'm not going to read that because it's very small, and I'm sure you could read that if you want to do that before you go to bed tonight. So really they're all about patient and public engagement. So the spectrum of involvement involves inform, listen, discuss, collaborate, empower. It's kind of what we're all trying to do really, but they kind of, I suppose, bring it all together essentially. But I think as long as we're all talking to each other, then we shouldn't be missing anything. So really, they're always looking for more people as well, and they also have a patient voice that they encourage people to become active with. So again, if anyone wanted to get involved with the Thames Valley Cancer Alliance and their patient voice, then Lisa is the person to contact there. And they obviously have these elements of what they do. So I'm assuming that you probably get these slides shared. So I think you would have all the contact details on those once you get them given to you at a later point. So I don't know if anyone has any questions about any of that. But otherwise,
The Thames Valley Cancer Alliance, is that an NHS-funded organisation?
as far as I'm aware, it is. Yeah. I mean, there's alliances all over the country, and ours is obviously the Thames Valley Cancer Alliance. It does do the BOB footprint, and I think they do talk to each other as well, which is helpful. But I think it's a lot of what we are doing as a sort of a group is about communication. It's about us making sure that we all know what each other's doing, that we're not all doing the same thing or duplicating, and that we're all working together, providing best practice.
Where are they based?
Thames Valley Cancer Alliance. They're not. I don't know where they're based. They're
So
not.
they don't have a base, but they
No.
cover Buckingham, Oxford, Berkshire West and Swindon, so that's it. So
Yeah.
So they're people working from home, basically.
they have a London base and a few offices around the country, so they can move around.
But so the Cancer Alliance is a lead cancer nurse, a lead cancer clinician, a pharmacist, Mark's the secondary lead, who spoke earlier, for personalised care, and we have threads, so I'm there's a breast clinical advisory group, there's a GI clinical advisory group, and we meet and we look at good practice, so a clinical practice, but also they try and get the patient partnership groups together so that what's happening in Reading might be, there's good ideas from Reading and Great Western in Swindon and Oxford, and I'm sure they have a screening arm as well. you have Southwest, don't you? You do bigger. Screening is slightly different, but they're an overarching umbrella that try and bring good practice across trusts within a network.
You explained it better than
Sorry.
Thank you very much.
I think that's our last speaker. Yeah. I think this is the last bit, the final bit. I just would like to thank you everyone for spending your day with us here. And I would like to ask Amber to come over. She's very shy. And I couldn't do this without her. She's been very helpful, arranging, accepting your emails, telling you what to do, where to go, and everything. And thank you very much, Amber, for doing that. I also would like to thank Vicky, my assignment manager, and Catherine Bailey, my line manager, who's always shaping me up to be able to put this kind of presentation and arranging all these things for you. Thank you very much for accepting me to your GP practice and responding to my emails, 5 emails. But I really, really enjoyed this role, and for me, throughout my 22 years of nursing career, this is the best experience I ever had. And I was skeptical at the beginning. I said to Catherine, I don't know how to do this role. And for me, at the beginning, I thought it was cancer, it's just a disease. And same as kidney failure, which I was a clinical nurse specialist by background. And it's very different dealing with cancer patients. And for 22 years, 19 years of that is spent to renal nurse specialist. And I can count in my one hand how many people I know who had kidney failure and had a dialysis. But when I started this job, I was only 3 months and 5 of my friends diagnosed with cancer. 2 of them died. And I was saying to Catherine, I can't do this job anymore. I don't think if I can make any difference at all. But I think that fueled me to continue this job and to have an impactful presence in the community, in the primary care. And for all of you who believe and interested in cancer, I think there's so many things that we can do for our patient. And I'm always a believer that if we empower our patient, education is the best weapon that we can give to our patient, and they can live a very fruitful life and feel well with themselves as well. So I think that's the end of the day. If you could, there's a QR code on your booklets as well. If you could do the evaluation for the day, and also you can get 5 CPD points for doing that. And I think that's it. Anything else? No.
So I just want to say thank you to you, because you have been fantastic in this project and made it a really valuable project. And everyone in Berkshire West is very lucky to have had you, as with our other nurses in the other areas. But I know it's been really difficult, especially at the start. You've done an amazing job, and I know that you will do amazing in carrying on in personalised care, which is really good. So thank you so much.